Hi, in this video, I'll talk about a breaking of water, which is technically, obstetrically known as a rupture of membrane. Now, the baby is protected in a sac, and the lining of the sac is known as the membrane. It's a placental tissue which wraps around the baby, in which the water is there, in which the baby is floating. Now, if these membranes are broken, then there would be leakage of water. What is the significance of breaking of water? Why does it happen? What you have to do if you have breaking of waters in any time of the pregnancy. In this video, I will explain. If you like the video, please like it, see to the end, and subscribe my channel if you want to know about these things. Now, breaking of the water is known as PROM, premature rupture of membrane. If you break your water before labor, it's known as premature rupture of membrane, or PROM. Now, if you break it before 37 weeks, means preterm, then it's known as PPROM, which is premature preterm rupture of membrane, or preterm premature rupture of membrane, whichever form you want to like it to say. Now, the membranes are very tough. It normally ruptures during labor, but even in labor, when we rupture a membrane intentionally, we try to rupture it, try to break it intentionally to get the labor progressing. It's not so easy. The membranes are so tough. We need a very sharp instrument, which has a tooth or even a very sharp knife-like thing to break it. Even in cesarean section, we have to cut it through the knife to break this water. It's so tough, it will not break. Now, what is the advantage of this membrane? Now, this sac, which is guarded by the wall of membranes, keeps the baby protected from the very nearby vagina, which is full of bacteria. It may contain very harmful bacteria for the baby. So unless the membranes are broken, no bacteria can penetrate this. So how does spontaneously these membranes break? They break commonly because of some infection. Some bacteria will go, and the enzymes of this bacteria will make this membrane very thin, which then ruptures, and the leakage of water starts. How do I know that I've broken water? Now, in case the membranes are broken, then in that case you're leaking water, and you will be constantly leaking water. It can come as a gush of water, just a large break and huge amount of water can come out, or it may be a constant nagging leaking, your undergarments, everything getting wet. So when somebody calls me or comes to me and says that I have probably broken water, I said just wear a sanitary pad and just walk around. If it's continuously getting leaked, then probably you have broken water. Now, how to differentiate from the spontaneous leakage of urine, which can happen during pregnancy? The urine there is a smell, and this water is clear, and this water is clear like urine and does not have that typical smell of urine. Is there any definitive conclusive test? Yes, there are tests which can, with some litmus type of tests, in which some papers can be introduced, and the color of the paper changes, and you know the waters have been broken. Or at the best, what you can do, you have to do an internal examination. If just with a speculum, special instrument, you can see the mouth of the womb, and you can see the dribbling of the water coming out. It's pooling inside the vagina, and you're sure that this leakage has this breaking of membranes have happened. And it is normally written as in the notes, dribbling. And the technical term, as I said, is that rupture of membrane, but PROM. Now, what is the danger? It's a very dangerous thing. Now, in the modern obstetrics, what happens is that if you break your waters, what happens, I'll tell you. I have told you why this breaking of waters happen. This is normally due to an infection. When the water has broken, it means the pregnancy sac is already infected. Now, because the membranes have ruptured, now the bacteria can straight travel into the pregnancy sac, can affect the baby. The researchers say the effect will depend upon how virulent, how aggressive the bacteria is, and how much immunity that baby and the placenta has. Now, it can be a condition is created because of this ascending infection, which is known as chorioamnionitis, which is itis means inflammation. This is an inflammation of the placental membrane. Now, normally what happens, the body understands that this infection, that breaking has occurred, and it takes its own process of expelling this infected product. The normally mother goes into labor within 24 hours. And if the mother doesn't go into a labor, what you have to look for is that whether there is any development of pain in the abdomen or there is fever. Fever is a very bad sign in this case. Fever indicates the mother getting infected. I remember when I was a house staff, somebody with a broken waters came, and we didn't have any beds in the hospital. We let that mother go home and telling her that come back if you have any problem, pain, abdomen, fever. She didn't come, and finally on the third day she developed septicemia and died. Very unfortunate. So breaking of waters have to be seriously looked after, cared after. Now, what normally the modern obstetrics do is that if somebody has broken waters and it has been proved, delivery should be done within the next 24 hours. And I normally do it within few hours as soon as I get a chance to get the patient admitted. Only that if it is very preterm, I may wait for a steroid injection to go to the mother, give the mother, so that the baby becomes a little bit mature lung-wise. I have done a video on steroid injection on preterm delivery. Please listen to that. Otherwise, I would deliver as soon as possible. I won't give the chance the mother get infected. Mother is already actually infected and the baby infected and can be severely damaged. So this is the modern obstetrical treatment of rupture membrane, PROM and PPROM. So if you break your waters, if you feel that you've broken your waters, immediately inform your doctor. If you like this video, please like it and subscribe my channel. If you have any question here, please shoot it down. I will answer.